Well, good morning on Friday the 13th. Time to free your thoughts. Get it off your mind. Call me now, 416-360-0740 or 1-866-740-4740. You set the agenda. You tell me what's important, what needs to be talked about on the radio. Let's hear from Barb in Burlington. Barb, what's on your mind today?
Good morning, Goldhawk. I'd like to talk about pulmonary hypertension.
Okay.
This is Pulmonary Hypertension Month, the month of November.
All right.
It is a very rare lung disease, and it affects the blood vessels in the arteries of the lungs.
It's high blood pressure in the lungs, isn't it, really?
Yes, exactly.
Yeah.
Exactly, and it can affect the left side or the right side of the heart as well. The drugs for this disease are currently under review with a division of our Ontario government called CADTH, and we are working closely with this group. There are currently 9 different drugs available to treat this disease. For pulmonary arterial patients, often more than one drug is used to treat these patients before they get any relief. CADTH are currently trying to treat all forms of PH as one drug treats all.
Yeah. How many people have it?
Pardon me?
How many people are afflicted with pulmonary hypertension? Do you know offhand?
I'm not really sure at the moment. I belong to a Toronto chapter support group. And there might be maybe 50 members of it, but we're trying to find out because it has been misdiagnosed over the years as asthma in a lot of people. So they are getting better at diagnosing it, so there should be more coming forward. It can affect anybody from a young baby right up to a senior citizen.
Really? Yeah.
So, everybody is involved in this disease, male and female, so it's not one side or the other more.
I see that.
Anyway, we feel very strongly that our professionals should be left to sort of decide which drug treats a patient the best, and if more than one is needed, that's what it is.
Well, that would make sense, wouldn't it? Yeah.
We think so, but the government obviously is trying to save money because these drugs are very expensive. So anyway, I'm just wondering if there's any newly diagnosed patients out there, letting them know that we do have a Toronto chapter support group, which they can find on Facebook under Pulmonary Hypertension Association of Canada. And we meet once a month, generally, in North York, which is relatively central to people east or west of Toronto and in Toronto. Anyway, if they'd like to check that out, that would be great.
Well, great. Thanks very much for reminding us.
Thank you so much. And thank you for letting me speak.
Oh, by all means. Thanks very much. Here are those numbers, 416-360-0740 or 1-866-740-4740. Here's Danny in Toronto. Danny, what's on your mind today?
Oh, good morning. It's good to hear your voice again. It's been a long time. Of course, it's this pulmonary hypertension issue, and specifically the what's called the CADTH, which is some federal agency that had a report come out within the last year and saying how it believes a one-size-fits-all formula for sufferers of PH is the way to go, and then if it doesn't work, we'll go for something more specific, unlike leaving it to the professionals, meaning the doctors and the teams that are in the respirology clinics across this country who are catering directly to their individual patients' individual needs. My daughter was diagnosed in January 2013. After a very, very short period of less than 2 months, her body had gone from a normal body to over 70 pounds above that normal weight, and she was literally drowning in her own body until the wonderful people at Toronto General, Dr. John Granton's team, rescued her and diagnosed this thing.
Well, so the basic premise here, and it's the same with the last caller as well, let the professionals decide the medications that are most important and most valuable to treat pulmonary hypertension. Is that not the idea?
That's, of course, the idea. I just don't know who are these mandarins who are hiding behind an anonymous screen called CADTH to dictate or want to dictate.
Well, we'll look into that, Danny, and see if there's anything there that we can report on, try to get some clarity, some clarification on what's going on. Thanks for fortifying the first caller. That's great.